Good afternoon, everyone.
Good afternoon.
Welcome,
Good afternoon,
welcome,
sir.
all of you. Good afternoon. Good
Good
afternoon.
afternoon, sir.
Nice
Good
to
af-
see some
good afternoon,
familiar
sir.
faces, and there are some new people as well. Welcome. All right, so we are here today to discuss about behavioral management in autism. Today is 27th of October 2024, and JKP Care Foundation has given us an opportunity to understand what is behavioral communication and how to manage behavior in autism. So, first of all, I would like to thank the organization, JKP Care Foundation, for organizing this webinar. My name is Dr. Alok Arora. I'm a clinical psychologist. Have been working in the field of autism for nearly 20 years now. And my understanding towards autism is totally out of my experience. So today what we are going to discuss is behavioral management, how to manage various kinds of behavior in autism through my experience. So there is no theory involved. I'm just going to share what I understand from my experience. What is autism behavior and how to manage those behaviors? So the talk is majorly focusing to parents, but yes, there are a few professionals here also. So most welcome, all of you. And let's begin. I'll just start a presentation. Initially, for first 45 minutes, I have a talk here. I'll present my screen, and later on, after 45 minutes, we will have question and answer session. So I'm open to all your questions. You want to ask anything about autism, um, and you're most welcome to ask. Please note down all your questions during the session. And in the question answer session, which will start after 45 minutes from now, you may ask all your questions one by one. I hope my screen is visible to all. Yes. All right. Thank you.
Yes, sir.
Behavioral management in autism, that is today's topic. First, I want to take a feedback from you all. Just quickly get onto your keyboard and type in chat box, autism is a disease, a disorder, or a difference. I just want to understand what you know autism as. Do you think autism is a disease or a disorder or a difference? There are three D's here: disease, disorder, difference. So just type in the chat box. Wow, I'm getting good. Disorders, it's a difference. Yes, Mary has said different. And rest everybody, okay. Kartika, Bhavna, yes. Ashwini, Ayushi. Difference, Abhirami says. Disorder, yes. The Krishna, Nilambri, disorder. Nobody is saying it's a disease. Pravina
No,
is saying mental disorder. Okay. Difference, Redmi 8A. Mansi, disorder, difference. Okay, great. Thank you for your input. So now I understand that you all understand it's a disorder or a difference. It is not a disease. So I don't have to talk about whether autism is a disease. Yes, autism is not a disease. So far, most of the professionals consider it to be a disorder, whereas I consider it to be a difference. So now let me justify my statement here. Autism is a difference in how the brain works. It is not a disorder. It is not a mental disease, a mental, disability or a disease. Autism is a spectrum, meaning that every autistic person is different and has their own strength, differences, their own needs. Please underline this, that they have their own strengths as well. They have differences and their needs are different. So each child or each person with autism will have different strengths. We need to look at the strength part. They will have differences and needs. Autism is a form of neurodivergence, which refers to people whose brain work differently than what society considers to be normal. So it's just that their brain works differently. That's why I say it is a difference. Just because somebody's brain is working differently, I cannot call it's a disorder. It's like uh, it's like we are in India. We are driving cars, and in the Western countries, we are driving cars. Left-hand drive and versus right-hand. 69% of the world is driving left-hand drive. Rest of the world, 31%, is on right-hand drive. So a person suddenly who comes from the US to India or goes to Australia, and if he has to drive the car on the roads of Australia or India, where they use right-hand drive, suddenly the person will have lots of challenges. Might end up making accidents on the road because the entire environment is designed for left-hand drive there. Sorry, right-hand drive there in India and Australia. Whereas the person has learned driving, has been practicing driving as in the USA. So suddenly when they are put to this environment, so I cannot call they have a disorder. They will act, they will drive weirdly, they will have problems, they will meet with accidents, but I cannot call that they are mentally disordered. So it's just that the social norms, our social norms, where we all fit into, children or people with autism, they don't fit into those social norms. They act differently. I give you another example. If you don't relate to this, some of the people who do not really, who have not experienced left-hand drive and right-hand drive, it's like eating with fingers and eating with versus eating with fork and spoon. Countries like Japan, Vietnam, China, when you go there, people eat with chopsticks. Western countries, US or most of the European part, people eat with spoon and fork. Many of the South Asian countries and India, majorly in southern part of India or Kashmir, people eat with fingers. So if a person from South India who has been living in South India and has been accustomed to eating with hands for 20, 30, 40 years, suddenly is put into an environment of Japan or China and has been asked to eat with fork and spoon. Will they be able to eat properly? They will be able to fulfill their needs? No. And people from China, they will look at them, if they start eating with fingers, people from China or Japan will look at them weirdly, differently. And what they will say, these people are having some mental disorder. That is what autism is all about. And that is why I say autism is difference. It's just the difference of brain wiring, neurological communication in the brain. So they think differently, they perceive differently, and they react differently. Coming back, autism is not, the last line, autism is not a mental health condition. So it is not appropriate to use terms like disorder, disease, or deficiency. It is not mental health condition. It is just the neurological communication, which is a little different. Now, there are 7 keys to manage autism. Majorly, when I say manage autism, there are the 7 points which I have noted down. So 7 keys. First and foremost is to accept. Most of the time, we as parents do not accept that it is autism. We always think, no, it cannot happen to me. It cannot happen to my child. Why it has happened to my child? I'm just running through the screen. I think I have some questions here I have already written. Wait. No, I missed adding those questions, but okay, no problem. Yeah, it's here. Sorry. So why autism happened to my child? Why me only? My brother has two sons. My sister has one daughter. My my brother-in-law has another son and daughter. They don't have any child with autism. Then why me? Did I do something wrong during the pregnancy period? Or is it a punishment for me for my karma or for my deeds or whatever we take it as? So this is the most common question. The moment we come to know that our child has autism, Most of the parents have this. And we struggle with this question, and there is nobody to answer this. We have professionals, we have doctors, we have therapists who will work with our children or with our child. But who will answer this question? So I'm here to answer this question to you. And my answer is you are special. For an example, if you have to go to a bank and withdraw, say, $1 million or 1,100 rupees, whatever the sum may be. But suddenly there is some situation, probably you are unwell or you have met with an accident and you're not able to go on your own. Whom will you give hand over the check? Who will go there and withdraw the money and bring it back to you? Will you give the check to your housemaid or house help, somebody, or will you give the check to your brother, or will you give the check to your mother who is not? I'm just giving you some options like KBC, and then I'll tell you their own strengths and weaknesses. Or will you give the check to your neighbor? So I'm giving you 4 options. One is a housemaid who's working with you at your house, but you do not have that much of trust on them. Second one is your brother who is educated and you have trust on him. Third is your mother, on whom you have a great trust, but she is not educated enough to sign or to fill up the receipt, fill up the form there. And fourth one is your neighbor who is educated, but you do not have that much of trust because they're your neighbor. So whom will you select? Just type in the chat box. I'm waiting for your answers. Brother, yes, brother. Agreed. Why did you select brother? Okay, somebody says mother, rest everyone is saying mother. Yes, I trust the mother the most, but I know when she is not able to sign or fill up the form, it's going to be really difficult for her to go there and do the formalities of depositing a check and taking the cash. So mother, I will not select. Neighbor, though neighbor is educated, competent, but trust issues are there. Maid, again, might be competent, housemaid or house help, but trust issues are there. So brother is the one on whom I have trust and is competent. And that's where the answer of all these questions lies. God, Bhagwan, Allah, Khuda, Almighty, nature, whatever form you believe in, the energy, they had this child whose brain wiring was a little different than all of us. And they looked around entire universe and found somebody who is competent, who's educated, who's competent, stable, mentally strong, all those competencies, skills, who has skills, and trustworthy. And they handed over this child to you. The answer to all of these questions, why this happened to my child, why me only, you should feel special because whichever form you believe in, the energy, the universal power, God, Bhagwan, whatever you say, they had trust on you. Also, he found competency in you. So you are trustworthy and you're competent enough to raise this child. That's why this child is with you. So acceptance is the first key, that we need to accept that child has autism, diagnosis has happened, and it is not a disorder. It is not a disease. It's just a difference. Now what we need to do is educate yourself and family. That family also plays an important role. So we need to educate ourselves about autism. We need to learn more about autism. We need to go into details of autism and understand which all areas are, what all types of autism is there, where my child stands, how can I support my child. You need to do education. Cannot just rely upon therapists or doctors. Therapists and doctors are important part of this journey of autism. They will be there to support you. You need their support at various levels, at various stages, educators, doctors, and therapists. But then ultimately, it is your child. If you will not accept your child, if you will not understand about your child's condition, then who else will do? So you need to educate yourself as well as educate your family. I'll come back to later. I mean, within this slide itself, I'll tell you why family education about autism is important. Some of you may say that, oh, I am a single mother. I am staying with my child. What does my family has to do with the child? Why should they be aware? Or we are just two of us, a couple, and we are raising this child. Our their like our parents or in-laws do not stay with us. Then why should I go and talk to them about it? Why should I talk to my neighbors about my child condition? Why should I talk to the school teachers about my child condition? Why should I talk to public when I take my child out, say in bus transport, and tell them that okay, my child is autism? It is like labeling my child, which I don't want to do. It's a common perception. We try to hide it. But now we know it is not a disorder. We know it is not a disease. It's just a difference. Then what is the harm? I'm wearing a gray color t-shirt. Somebody is wearing yellow here. Someone I can see on the screen black. Someone I can see screen on the red. So we all are different in our choices. Same does our children. So if my child is different, then why should I hide it from anyone? Yes, child is with autism. There is no harm in saying. Now, after getting educated, after educating family, relatives, close circle, understand. Understand your child. This is the third most important key management in autism. Most of the time, we fail to understand our child needs. We fail to understand our child. And for understanding, yes, today itself, we will discuss in detail how to understand our child's behavior. Because the topic is behavior management. So if we have to manage the behavior, we need to understand the behavior. Each behavior, if you understand, you will understand entire, like you'll be able to manage it better. Support. After understanding your child needs, child strength, understanding is like child strength, child needs, child demands, all those things we need to understand. And then we need to provide support where all my child needs support. So after this session, I want all of you to make a diary or a notebook, write down. First is how much acceptance is there in you. Just rate yourself as a parent, 100%. Oh, I completely accept my child as an autism. But back of the mind, if you have, why I have this child, what will happen to his future, why I am doing this, why this child has come to me, all those questions, then it is not 100%. Then please rate yourself. Where do you stand in acceptance? Then rate in education, where you stand. It's a self-analysis. Then how much I understand my child. What are the strengths my child has? What are the deficits my child has? Which areas my child needs support? Then fourth point, you need to write down support. So support is given by the doctors, the therapists, special educators. So what all support my child needs? Which all areas my child needs support? So physical health, rate your child on physical health. Okay, he is getting fever again and again. His immunity is low. He has some physical concerns along with autism. So which all areas? So you need to visit the pediatrician, or he has some eyesight issues. So you need to visit an eye specialist. So that kind of support you need. And secondly, in the therapies. So which all areas my child is lacking in deficits are there. So I need to provide, do I need to provide occupational therapy? I need to provide speech therapy. I need to provide diet and nutrition therapy, which is usually ignored. People don't talk about it. So do I need to provide diet and nutrition therapy? Do I need to provide speech and language therapy or special education support? whatever I require. So write down, list down the support, which all areas you need to support your child, where you are supporting right now, and which all areas further you need to support. Then the fourth key to manage autism is child environment. What do you understand by this word child environment? If you can describe it in just a one liner on chat box, anyone or everyone, because it's a comparatively it is a new term. It might be a new term for many of you. Child environment. So what do you understand by environment? Is it the I'm waiting on the chat box. I've opened my screen chat box on my screen, so I'm waiting for these news. Okay, safe and suitable for child. Yes, Kartika, correct. Is it the temperature? Is it the, yeah, palan poshan of the child? You mean to say, like I'm translating it in English? Very good word, palan poshan. In English, it is called the upbringing of the child. Yes. The surroundings with which the child is raised. Yes. House, school, asthma, correct. Good, very good inputs. Very good. Upbringing and surroundings of the child, therapy center, house, school, and therapy center. Asma says, Mary says upbringing and surrounding. Yes, agreed. Agreed. All of you are correct. Caring and surrounding. Ashwini, yes, you have touched a very emotional part. Caring is comfortable and positive environment. Yes, therapies. Okay. So child environment it consists of all this, what you are talking about. All of this. An environment has two things. One is where the child is being raised. So the physical environment, we call it, and people around that also make very important part of the environment. People with whom the child is interacting. Usually when we say environment, most of you have missed it, that you have nobody has spoken about people around the environment. They are also part of childhood. So the school, wherever child is going to, special school, regular school, the therapy center, the doctors he is meeting to, the home, people who are coming at home, these parents, relatives, neighbors, all together we make child. Consider you have joined a new job. Just you have joined today with lots of excitement, energy. It's a new job for you. And once you enter in the environment of your office, environment is not friendly there. People are not very positive with you. People are trying to ignore you. They are not supporting you. And all that they talk about is the concerns which you have, the weak points of yours. All that they talk about is this. How long will you survive in that job? Will you be happy with that job environment? Will you be happy with people there? Where you are being ignored, you are not being involved actively in the office environment, where people are just talking about you on your face or back of you, just the, the your negativities or your deficits or your weaknesses. Anyone who would be happy there? And how long will you continue in that environment? It's going to be very difficult. And you will end up resigning from that job within a month, 2, 3, 4, not more than that. You can't survive. You will get, you will lose your confidence. You'll get inferiority complex. So your mental health will be disturbed. You would need support of psychologists or counselors. And isn't the same environment we are raising our child entirely? I'll just quickly take you to another screen. These are the child environment. This is the child environment usually we are giving. This is all we are talking about the child. You can see on the screen, read it. Neighbor is coming to my house. I'm talking to the neighbor. Neighbor is asking me, oh, how is he doing now? He's better. I say, yes, he is doing better. He has learned numbers, but still he cannot do plus and minus. He cannot do sums. Granny is coming at home and she's saying, oh, he's not eating on his own. He's 6 years, still he's not eating. Relatives are talking, he's not talking, he's not speaking. All the time he's watching TV only. Moreover, especially parents where females are the housewives, mothers are the housewives, and husbands are working. The moment husband comes back home from the work, mother starts talking to the husband, the father. Oh, I'm so tired. He did this today. He did that today. And it's all about negativity. It's all about the deficits the child has. We are talking about that entire day. We go now, this is the environment at home. We take the child to the therapy center. Their therapist is saying, oh, he is not doing this. You are complaining to therapist that, okay, you taught this, but he is not doing it at home. Therapist is also complaining to you. No, he's not listening to me. He's not sitting. You do this at home, then he will do it. Then we are going to a doctor and we are talking to the doctor also about the same. We are going to the school. School teacher is complaining, always complaining about it. We are also complaining to the school teacher. So wherever we are taking the child, we are taking our child to a mall. So people are looking at it. And some people are, his child has got suddenly behavior, he's screaming. People start complaining about it. So what kind of environment are we giving to our child? Isn't it full of negativity, full of negative energy? And if we are giving that kind of environment, how can we expect child to behave as per our social norms? Child will start avoidance, escapism. Child will have mental disorders. Now a child will start developing mental disorders. By birth, with autism, it was not a mental disorder. But here, after getting that kind of environment where there's a lot of negativity for him, he will start developing mental disorder. He will get a kind of depression. And this is where pediatric depression starts in autism. Children with autism are 4 times more prone to pediatric depression, absolutely because of their environment. And you all must have heard about regression. There are some research going on this. But yes, pediatric depression or child environment could be a cause of regression. It could be. And my experience is it is the cause of regression. We say that child was doing things and suddenly this regression has come. He has stopped doing everything. It is like child has just surrendered. What you would have done in that office environment, I gave you an example. After 4 months of torture, that people are ignoring you, people are complaining about you, no matter how good you do, you just get the complaints and people are pinpointing your mistakes all the time. In that environment of office, what would you have done after 4 months, 5 months? Shut down. You will just say shut down. Either resign or quit. This is what child does. And then the regression comes. So child environment plays very, very important role in managing of autism. So we need to, coming back to our screen, 7 keys of autism, child environment is very, very important. We need to correct the child environment. So when you sit back after this session with a diary with you, when you are writing down about acceptance, education, I would request all of you to just take a screenshot of this page if you want, all these 7 points, or you can note it down. Um, I will ask the JKP team to share this PPT also with you all, so you can go through that PPT later. But when you write down these points, so write down child environment. Look at the environment of your child in the school, in the neighborhood, in your own house, and try to correct that environment. Wherever you find negativity is there, do not take your child there. First, go back to that environment, educate people there, make sure the correct support is being provided, and then introduce your child back to that. So from today at your home, no complaints about your child. Understand your child. Understand, provide support, understand why he is reacting to in a different way, and provide support. Teach him. Communicate. Communication is the sixth most important key in autism management. What is communication? Now, there are many children in autism who are non-verbal communication. or who speak very little words. And most of the time, we as parents do a mistake that we also speak little words with them just because they have not developed their own speech. Or sometimes they have speech but not the language. So we also stop the communication. So communication is not just speech and language. Communication is to deliver what I am thinking and to accept what somebody else is thinking. It could be by word of mouth, the speech or language. It could be non-verbal communication also. So when child is trying to show something to you in his own way, because that is the communication child has learned, try to understand that communication and speak back to the child. Do not stop your communication with the child. So communicate as often, as much as possible. And last but not the least, autism management, seventh key is patience. As a parent or as a professional, as a therapist, whosoever is dealing with autism needs to have patience, a higher degree of patience. We can't lose patience. So do meditation quite often, develop the patience management skills, learn more about patience, and the moment. I'm just muting you. We will discuss in the question answer session if you have any question. Yeah. So patience, it's very, very important for parents and professionals, all therapists. Without the patience, we can this. So patience is the seventh most important key into management of autism. Now coming to the behavior management now. This was the autism management altogether, but coming to the behavior management. What is behavior? Behavior is just a form of communication. If I look at you and I smile, that is a behavior that I'm happy to have met you. I think somebody is unmuting again and again. I'm requesting Lizel DMC. I request you to keep yourself on mute. Don't unmute again and again, please. It is disturbing. Yeah, thank you. Okay. So behavior itself is a communication. If you meet a neighbor and just wave hi, it's a communication. And sometimes absence of some behavior is also a communication. If you meet a neighbor to whom you used to say hi every day, Lizel, please don't unmute, otherwise I'll have to remove you from this meeting at this time. Please, it is disturbing us again and again. Yeah. So presence of a behavior is a communication, we all know. But absence of a behavior when expected is also a way of communication. We all use behavior as communication. When a child is born, an infant cries. We all say child is crying, child is crying, child is crying. But it is the mother who understands the patterns of crying and says child is crying because child is hungry. Child is crying because child is sleepy. Child is crying because child might have some stomachache. So there are patterns in birth cry as well, child cry as well. That is behavior. That is how they are communicating to you. That's way of communication. Child does not have speech and language, an infant I'm talking about. So by his behavior, he's expressing to you that I am hungry or I'm sleepy or I have stomachache. There are patterns. You can understand that. There have been a lot of studies of that. So behavioral communication is like any form of behavior by which I'm trying to communicate something is called behavioral communication. Any form of behavior which just a minute, sorry. Yeah. So children communicate through behavior. Children with autism might behave in different ways, and this behavior is often related to communication. So behavior when we say behavior management, we need to understand their communication and manage that communication, teach them techniques to give correct techniques which we understand for communication. Their behavior automatically will be managed. For example, self-harming behavior, tantrums, aggression towards others might be a child's way of trying to tell you that they need something, they aren't happy, or they are really confused or frightened. If your child behaves in difficult ways, try to look at situations from your child's perspective to work out the message behind your child's. When will it happen? When you understand autism, when you understand your child. So when you learn from child's perspective, you will understand behavior coming out of that child is trying to communicate something to. Going forward, use of day-to-day behavior as communication, I already mentioned, or any behavior or its absence when expected may be just as communication. When you meet your neighbor, you are you expect to greet each other every day like or whenever you are meeting, you greet each other. But suddenly one day your neighbor is not greeting you or not saying hi or hello to you. So this kind of behavior is considered to be a behavioral communication. That sudden break into that behavior, sudden change in that behavior. So any behavior that is the absence of the behavior when expected is also a communication. By that behavior also, I'm trying to communicate to you that I don't want to talk to you. I'm upset with you for some reason. So this is behavioral communication. So with all our children, they communicate something through their behavior, be it self-harming behavior or, we call them as tantrums at times, or hyperactivity or meltdowns. All those, by all doing all those things, child is trying to say something, communicate something. And child has learned that way of communication only. That has been registered in his mind. Like when a small child of 3 years, 4 years goes to a grocery store with you, or a mall, or a departmental store with you, child will be attracted towards those toys or chocolates or eatables which child wants to pick up, chips and all. And if you don't give that, if you don't allow the child to pick that up, child will start crying. Some of the children, they will show more hyperactive behavior. They will lie down on the floor, they will cry. And just to escape yourself from that, social setting, what you do is you just buy that chocolate or chips and give it to the child. This is the first interaction between you and child, first communication, where child has learned that I need to show this kind of behavior whenever I need something. Whenever I need something which I'm not getting, which they are denying, whenever parent is going in denial mode, what I need to do is I need to show some hyperactivity. I need to cry. I need to lie down on the floor, and I will get that. This is the first incident when it happens. And once, twice, thrice, 4 times when this incident happens, the behavior gets registered in his mind. Now the child does not understand child is doing good behavior or bad behavior, wrong or right. So no point in teaching the child with autism that this is good, this is bad, this is wrong, this is right. We just need to understand the communication and teach the child how to communicate better. No? Okay. No problems. If you're finding it difficult, I am taking to a little simpler example of how to modify this behavior. Behavior is there, and now we know that with this behavior, child is trying to communicate something to you. Child is coming back to the same example. Child wants the chocolate, and at that time, child is showing the behavior, tantrums, meltdowns, hyperactivity, self-harming behavior. Because child has learned, if I show this, I will get chocolate. What is the ABC analysis says about it? Let us understand. What is ABC? ABC is A for antecedent, B for behavior, C for consequence. Antecedent is what happened before the behavior. Behavior is what exactly happened, what exactly child did, and consequences, how the child got settled, what did child achieve by doing this behavior. And this analysis works on all of us. What happened before enrolling or registering for this webinar? You all had some or the other difficult reason to enroll for this webinar. And what you had, maybe you are a parent who has child with autism and struggling with behavior. You wanted to understand how to manage behavior better. Or that is antecedent for you. Or maybe you are a professional who's working with children with autism and you wanted to understand how to manage behavior better. Or maybe you are a student who is still studying but wants to make a career in support, creating a support system or in supporting children with autism or adults with autism. And so you wanted to understand autism. So that is the antecedent. Maybe you are somebody who's doing a research on autism and wanted to write down few things about behavioral autism, behavioral management in autism. That's why you joined this webinar. So for joining this webinar or registering for this webinar is the antecedent. Now the behavior here is that you have logged in on time, you have come here, you are attending the webinar, that is the behavior. And what is the consequence? Consequence is that you will learn something out of this behavior. You will get something out of this behavior. By attending this webinar, you will learn some new concepts. Some of the concept might be old for you. Some of the concept might be that you already know about it, but something new you will take from here. That is the consequence. What if you feel there is nothing new in it? I know everything. There was no use of it and it is waste of time. Whenever you find such webinar, you will not join. So what you will do, consequence, if you don't achieve that consequence, behavior will change. If you don't get that consequence, you're getting it. What was your expectation from this webinar? If you don't get even minimum of that, if your expectations are not fulfilled, then you will not join such webinars again. You will say, no, these are waste of time. They just come and speak and go. So the behavior of registering for this webinar or attending this webinar is gone. Or if the antecedent is not there. If child is on no autism symptoms, if child has grown up and there are no more autism symptoms, you have worked with the child, now there is no need of behavior management of the child. So antecedent is not there, you will not join the webinar. So joining the webinar or attending the webinar is a behavior which has come out of the antecedent, that is, you are in need to understand autism behavior management. And consequences, you are learning something new. So if I change the consequence that you are not learning anything new, you will not join that behavior. Of behavior is that your attending the webinar will not be there. If there is no antecedent that you don't need to understand autism anymore or behavior management in autism anymore, then also you will not join the webinar. So behavior will be changed by changing antecedent or consequence. Whereas we struggle and we keep on working on behavior and we want the behavior to be changed without changing antecedent or consequence. We don't change antecedent or consequence with the children with autism. What we do is, whenever the child is having behavior, child is shouting, we also show the behavior. We also start shouting back. We start hitting the child. We start telling, no, this is bad behavior. At the time when the child has behavior and we are telling, no, you are doing wrong. Don't do this. You are not supposed to do this. I told you not to do this. But that time child has shut down. Child is not ready to take inputs. Thus, we fail in managing behavior. So for behavior management, we need to change either antecedent or consequence. All behavior can be thought of as communication. The ABC approach can help you find out what a child is trying to say or what the child is trying to achieve. Coming to ABC, A is antecedent. What is the reason for the behavior? Antecedent, you just understand in a very common language, that is what is the reason. B is behavior, whatever child is like showing behavior and sees consequence. And we all do this. These are some of the screens. Yes, this is the record sheet. I want you all to start recording your child's behavior in this sheet. And trust me, 15 days, not more than that. All sorts of behavior. In a day, child will show 3 times, 4 times, 5 times, 6 times hyperactivity, not more than that. Or behavior that is not acceptable to you, acceptable to the society. So whenever the behavior happens, just after the behavior, take some time, or every day evening, take out some time, fill up this sheet. You may take printouts of these sheets. I'll share it with you all. So you may take printouts, or you may make these sheets in your diaries, and every day for 15 days, not more than that. And trust me, after 15 days, when you go through this, you yourself will understand why child is behaving like this. And you will change antecedent or consequence, and behavior will be changed, modified. So what does this sheet says? You need to record the date and day and date. You need to record time. So what time it has happened, when, which was the day, which was the date. So say Monday on 28th of October at 4 o'clock. Then antecedent, what happened before this. So first of all, you will write the middle column, behavior column. What did child do? Child started screaming. Child was sitting, playing with his toy. Suddenly he started screaming and crying and jumping. How often does it happen? No, it just happened for the first time. How intense it was? It was beyond control. And for how long? 10-15 minutes. After writing this, what happened before the behavior? Before the behavior, child was playing for last 2 hours with one particular toy. And what is the consequence? What did child achieve? How did you react to the behavior? What did child achieve of that behavior? So what you did for last 2 hours, child was left alone with the toy. Child was playing. By after this behavior, you were doing cooking in the kitchen. Suddenly you left all cooking and everything. You went to the child. You took the child up. You holded the child and you tried to cool down the child and gave him some food or some chocolate. This is what you did. That is the consequence. What did child achieve? Child achieved your attention. Child got some of your time. Child got a piece of chocolate. Child got a hug from you. So this is the consequence. All these are the consequences. Now you need to write this sheet, fill this sheet every day for all types of behavior, whichever you get, for 15 days. Within 15 days, you will start understanding your child. You will do the analysis, and you can always play with antecedent and consequence. However, after 15 days, if you have any questions, if you have any struggle in understanding, I'm available. You can connect with me, and but before connecting with me, send me the sheets which you have filled up. So I'll go through with the case history, that how old is the child and what are the major concerns you are facing with the child, all that, understanding your child and support. And then you connect with me. We'll fix up an appointment. We will discuss it more in detail, and I'll help you to understand this ABC analysis. But this will help you to understand your child much better and to handle your child's behavior much, much better way. So you need to record the behavior, analyze the underlying causes. What could be the setting and triggers? What could be the causes? Causes could be, in the example which I gave you, that child was playing alone for 2 hours. Mother was cooking in the kitchen. So what could be the possible causes there? Settings: child was left alone in the room, mother was in the kitchen. Triggers: child was hungry, child became hungry, and that could be a trigger. Or child felt alone, could be a trigger. Maybe there was a sound outside, sudden sound, some whistle in the kitchen, or you started a mixer grinder, and that could have bothered the child. Children in autism, many of them have audio hypersensitivity, so such sounds trouble them. So that could be the trigger for this behavior. And what is the result? End result is that you holded the child, you hugged him, you calmed him down, you spent some time with the child, you gave him a piece of chocolate, biscuit, or whatsoever. So these are the consequences which child got. Then alter the results or triggers. Whatever results are there, you alter them, or whatever triggers are there, you alter them. But when will you understand this? You will understand that for a behavior, there could be 10 antecedent and 10 consequence for one behavior. Like in this example, antecedent could be that there was a sound outside, whistle of pressure cooker, or maybe grinder sound, maybe some traffic sound going out. That could be, or the doorbell, that could be trigger. Or trigger of child being alone for longer period could be a trigger. Or trigger of child being hungry could be another trigger. So likewise, there could be many triggers and many results also. That what did child achieve out of it? Child achieved your time, child achieved your hug, child achieved your like some food articles, food items, or you gave another toy to the child. So these could be the results. So when you do more of behavior analysis, this ABC analysis, same behavior, you find the 10 triggers, 10 consequence, you find the similarity between those triggers and consequences. Then you reach to a result, common result. Okay. So start doing this ABC analysis. This will help you a lot in behavior management. Then behavior support plans, how to support the child in behavior. Identify the concerns of behavior. Know the triggers. Then manage the strategies. Pre-plan things. If I'm taking my child to the mall for shopping, I'm going for grocery shopping, I want to take the child there. Now the identify, what all triggers could be there when I take the child. So pre-plan. And then how will you manage that? Reducing impact of incident. Whatever incident is there, you need to try to reduce the impact. You cannot control the behavior. Don't try to control behavior. Behavior is there. It is outcome of some antecedent or some consequence. So immediately you cannot control it. Don't try to punish the child or scare the child. That don't shout. I told you not to shout. Don't start showing hyperactive behavior on your own. Response strategies at each stage of behavior. In behavior also, you'll find many strategies. Suddenly, child does not get hyperactive. Child will show you some symptoms of hyperactivity before getting hyperactive. So try to manage those symptoms then and there, then hyperactivity will. Then follow up a behavior. Once you do this analysis, follow up a behavior or debrief yourself. And review your analysis periodically. So 15 days, you do this ABC analysis, start working with your child, but review after 3 months, again do 15 days ABC. And I suggest to all my patients that you continue with this ABC analysis on a daily basis. After 2 months, 3 months, you become expert of your child. And the behavioral problems are more or less 50% solved. Not all of them, but 50% of behavioral problems are solved by doing this ABC analysis. There are some practical suggestions for children with autism in their behavior that incorporate a routine. You will not get much of behavior concerns if they are fixed up in a fixed routine. Minimize unstructured time. Unstructured time is what? When they do not know what to do. They are left alone and do not know. Sudden time. Suddenly, every day there is a therapy session from 4 o'clock to 5 o'clock. But today, therapist said that I am not available, and then you don't have a session and child does not know what to do at this time. That is called unstructured time. So if a therapist is taking session 4 o'clock to 5 o'clock every day, but today's therapist is not there, then you should, as a parent, you should get involved with the child and do some activities. Take some homework from the therapist and apply that homework here. Whatever therapist is doing, learn from them, take some homework and apply them at home. So minimize the unstructured time. Be aware of the environment. Wherever you are taking your child, just be aware of the environment, because environment is the biggest antecedent in behavior. When I say environment, I don't talk about only the atmosphere, I talk about the people around. If there is someone who is always talking bad about me, who is always criticizing me, then I will not like the presence of that person around me, and that is natural. I can feel that negative energy from that person, and that negative energy stops me from being around that person. And if you take me around that person again and again, I will show behavior again. Use practical problem solving. Problem solving, behavior problems. There is no specific strategy I can give you that, okay, this stick will help you to solve the behavior. Yes, for some time you can subsidize the behavior, sometimes by shouting at the child, but that is not a practical solution. So use practical solutions. Think about an individual in terms of their autism. Put yourself in the shoes of uh, the child. When you can do it, whenever you, only when you can understand your child better. Now, being from the psychology field, I would say that we are, like the psychologists, are trained to put ourselves in anyone's shoes. So first of all, whenever somebody comes to us with their problem, we understand their environment. We understand who all are part of their problem. We put ourselves in their shoes and then start thinking how they are thinking and connect with. Similarly, with autism, you have a child, then you understand child's struggle areas, child's strength, and how child thinks, how child is perceiving things, and how is child reacting. Then you will understand the behavior and how to modify that behavior. So you need to think from the child's angle. Involve everyone around you. It's not your problem. It's not a problem, first thing. But again, it's not your problem. So involve people who are there around. Do discuss, do not hesitate to talk about autism. By 2030, we are today, the last, I think, the last survey which has, report which has come out in the US says one child out of 36 is with autism. When I started practicing, it was one child out of 256. So from that journey, 256 to 36, we have reached. And our prediction is one child out of 10 with autism in 2030. Just 6 more years to go, or 5 more years rather to go. So autism is very common. It is not, I mean, something to be ashamed about. It is not something to hide. Talk about it. Involve people around. Do not hesitate to discuss. Tell them that, okay, this is autism. Educate them. And ensure consistency. Whatever you are doing, be consistent in. It's not that suddenly one day I do like 10 days I'm taking the child to a therapist unit, okay, and then the therapy, there's no result coming, and then I'm stopping the therapy and I'm going to some other therapy. Somebody told me, that is like, I call it window shopping, that somebody told me go for this doctor, he will do some miracle, and you go there, 15 days you are there, and you see, you get disappointed, and then you suddenly switch over to some other doctor or therapist. No, you need to be consistent. Whatever you are doing, whatever skill you are teaching, break the skill into smaller parts, smallest possible part, and teach to the child. Whichever therapies you are doing, patience is the key. Results will take time. Do not overburden yourself with results. Patience is the key in autism management. Most important is both parents involved. If both the parents are living in together and taking care of the child, then both the parents should be involved with the child. Family education, we have already discussed about it. Your own health and me time. So your own health as a parent, as a mother, as a father is also very important. So when this child was not born, that time also you were leading a life. But then suddenly when a child with autism comes in our life, we leave everything. All our dreams and all our, kind of hobbies and everything goes for a toss. And we are just running behind the child from day to night. Isn't the story of most of you? This is the story of most of you. But you are also an individual. You are also a human being. You need me time. You need to have your hobbies. Yes, I understand you have a added on responsibility. But that doesn't mean that you will not do anything else for you. So take out some time for yourself. Continuity of therapies is very, very important. In autism, at various stages, various times, you would require various therapies. And that continuation is important. taking a therapy for 15 days, 1 month, 2 months, and then giving a break. Okay, how much difference does it make? Child with autism, okay, no problem. We are going for 1 month holiday. We will come back. Then we will again put the child for therapies. It makes a lot of difference. 1 month of holiday puts the child 3 months behind. So even if there is need of holiday, if you are taking a holiday, fine, but take the homework from your therapist, so that when you come back, child is at least till that level where the therapist had left them. Child is not going back. Okay. Learn child's communication by behavior. And sorry, I missed respite care. Respite care is what? When child is being cared by someone else, child, your responsibility is being shared by someone else. Why respite care is important? Number one, to give you me time. Number two, to prepare child to be with others as well. All the time, child is with mother or with father, and father or mother is taking care of all the needs all the time. But once in a month, I suggest once in fortnight. If not possible, then once in a month. Child should be taken care by the grandparents or by the close relative, family friends, brother, sister, or anyone else whom you can trust the most. And if not, then the therapy centers, therapists should start respite care facility in their therapy units. Maybe once every third Sunday, it's a respite care day. So all the children will come to our center. We will take care of them. We will not give any therapies. We'll just take care of them, feed them, do some play with them, keep them engaged, so that the mother or father gets some me time. Their own mental health, goes on the toss. So they need time to repair. So respite care. And by doing respite care, what happens is now mother is the one or father is the one who's running behind the child the entire day, who's taking care of the child day and night. What if suddenly mother or father, any one of like who's a caretaker, who suddenly gets some urgent work or suddenly gets say ill and is not able to take care of the child, then it will become very difficult for a new person to take care of the child, because new person suddenly will not understand the child and child will not gel up with the person, and then you will have a lot of behavior. But if the child is in habit, after 15 days, 1 day with mother, with grandmother or grandfather, or with uncle or auntie, child is in habit of that. So then it is easy for the family members to handle the child. It's easy for the child also to be handled by. So respite care is important. Learn child's communication by his behavior. The entire talk I've been talking about communication by behavior. Every behavior is a communication. So the most important is that you learn child's communication. Whenever child is showing a behavior, you should understand what child wants to say. Even if child speaks or doesn't speak, but with behavior, you should understand what child say, what child is trying to communicate to you. All right, I'm open for your questions now. That's all for the presentation. Let me just check this chat box. I've not seen it for long, and there are some messages. Okay. Dr. Sama, PT, she says, I agree with you, sir. Nowadays, parents are thinking as a short-term course for therapy, not maintaining consistency. Yes, yes, Dr. Sama, that is happening. That's why I just raised the point here. Burns out parents causing frustration. Yes, Asma. And for that, we need respite care. We need me time for parents. A healthy mother can raise a healthy child. If you yourself like are psychologically down, your mental health is gone for a toss, then definitely you will have struggles. Not only you, your child will also struggle. Yes, open for the questions now. Any question, you can unmute and ask. Anyone?
Sir,
Yes.
uh, it's not actually a question, but just wanted to share a incident which happened with me. Uh, I was in the hospital to take the UDID card for my child.
Mhm.
So I was standing in the line, and the lady who was just in front of me, So she saw my child and she said in Marathi, नाही हा पण असंच येड्यावानी करतो का? So at that time I felt that these people need more awareness, but I was unable to uh, react to that question. So I just said yes and I moved on. So what should we do in such a situation? How to create the awareness among such questions or such people who are zero in the awareness? I just
Yes.
don't understand it.
Yes. So Nilamri, here are some people who are from the other language backgrounds and do not understand Marathi. So I will rephrase or I will translate that in English what you said, that uh, as Nilamri mentioned, she was in a queue in a hospital for UDID card, and there was a lady in front of her, and she asked Nilamri that about the child and said whether this child also does behaves like a mentally ill child. Okay. And this is a very weird situation where parent does not have the answer to it. And as Nilamri said, she just mentioned yes and gone. But yes, so creating awareness is not just by one person or one organization. Okay. We all have to play our roles. That's why I mentioned here when the awareness will come. Awareness will come when people around us know about autism. So do not hesitate to talk about autism. When you start talking, definitely awareness will come. Now, here are, I think, 64 of us now. If we talk to 10 people in a month, every month we make a mission that we will tell to 10 people about autism. So 640 people we are teaching about autism in a month. Again, multiply that in a year, 5 years, 10 years. So you yourself or we as a group ourselves can create awareness to thousands of people. And imagine if all the parents with autism, all the therapists who work for autism start talking to 10 people about autism, 10 new people who do not know about autism, right? So in such situations, as you mentioned, it is, you said yes, okay, but if I would have been there, I would have explained them in 4 or 5 lines what autism is instead of just saying yes. So make a script for you, just 4 or 5 lines, what autism is in a layman's language, in your Marathi language. And whenever somebody is putting in such question, or whenever you're going to a new environment where people do not know about autism, tell them about it. And there's nothing to be shy about. It's just a difference. Yeah. Yes. Thank you. Thank you, Nilamri, for sharing this incident with
Yes,
us.
sir. Thank you, sir.
Okay, I have questions here on the chat box. I'll take them one by one. Autism awareness is needed in the school. Yes, I do not know your name. It is showing me just N, but yes, it is very much needed in the schools. It is very much needed in the schools. Miss Faisal Atif, I'm just seeing, yeah, I'm seeing from the beginning now where I left. If child is full aggression without anything that triggers him in the classroom, sometimes with a seizure and tries to harm other. One thing is, this is a very common line that without anything, something has happened. But in this world, nothing happens without anything. There is a reason for everything in this entire universe. So yes, if child gets aggression, definitely there is something. We just need to find out what is that thing that is having. So Miss Faiza Atif, let me give you a small incident, which is a real incident. And a parent came to me long back, I think in 2014 or 15, complaining that everything is fine with the child. Child is with autism, but we all domains are developing and child they are providing therapies and support system. Everything is fine. But for last 1 month, 1.5 months, suddenly in afternoon timings, around 4 to 5 p.m., usually in afternoons, without anything, the word you mentioned, parent mentioned the same thing. Without anything, without any reason, suddenly child becomes very aggressive and start screaming and start throwing things here and there. And then he settles after 10, 15 minutes, he settles down. This was a difficult case for us because we tried to find out all the. I was directly relating it to the diet because it was after lunch hours. So I was thinking that it is something to do with the diet of child. So I did the analysis. I asked my dietitian to do a detailed diet plan and make changes in the diet and stop hyperactive diet and all those things we did. But again, situation was the same. Then in the second or third sitting with them, it struck to me that what is there? It's like the line I said to you just now. I said the same thing to myself that no, without anything, nothing happens. So there's a reason. What could be the reason? Then in the consultation with parent, I note down all the points and what is the environment. I came to this environment analysis and who all are the people in the environment at that time. So child is usually in the bedroom after because this is the case of Goa, and in Goa, in India, we have this regular practice that in afternoons, like from 2 o'clock to 4 o'clock, everything is shut down. All the shops are closed, market is closed, and after lunch, almost everyone in Goa goes off to sleep, a short nap for 1 hour, 15 minutes, 30 minutes. They take nap, and then they go back to their work. So markets are also closed. So this incident was in Goa. So I was assuming that, okay, after lunch, and the family, who's a local Goan family, so they definitely follow this routine. They go to sleep, and then child wakes up. So I was relating it with the environment. And after doing this ABC analysis, after writing down 3, 4, 5 days, we suddenly found one day this behavior is not there. And that's where we got the key. What has changed in the environment? What is, and that one day this behavior is not there. Otherwise, this behavior is continuing for entire week. And what was the reason? We reached to at that though a child was there in the bedroom at that hour, but there was a house help or housemaid who was coming at around 4 o'clock every day and cleaning the vessels in the kitchen under the sink, washing the vessels. So the sound which she was making was bothering the child. Then we did the auditory sensitivity test for the child, and we understood child is auditory hypersensitive. How we reached to this conclusion is that the day when this behavior was not there, that day that maid had not come. The housemaid, house help had not come. So we realized because that house help always was in hurry, she used to make a lot of sound with vessels, and this sound used to uh, was not tolerable by the child, and child used to get the hurt. So there is always something for the trigger. So there's some trigger always in for every baby. So in the classroom, if you're saying suddenly child is getting hyper, maybe child is getting bored of your class. Maybe child wants, like for that 20 minutes, child is attentive in the class, child is listening to you and everything. But after 20 minutes, child want to escape from the environment. And for escaping, what he has learned is if I throw things, if I put a scissor in my hand, or if I try to harm other, then consequence. What consequences? You send the child out of the class, probably to a resource room you send, or some special educator or some support staff takes the child out for a walk. Something like this you do. So maybe child, to achieve that, to reach to that consequence, child is showing this. So we need to do a detailed analysis. You please do the analysis. What is the antecedent? What is the consequence? And then you will come to the conclusion for sure. Faisal. Abhirami, is there any scale to assess the behavior of child? No, there is no scale to assess the behavior of the child because every child is unique and different. So their behavior are different at with different timings. Also, it depends on the cultures. It depends, as we discussed just now, eating with fork or eating with hands and spoon. So it depends on the environment they are brought up. It depends on the climate conditions. It depends on the surroundings, people. So behavior of a child who's grown up in a village area where uh, he has not been exposed to much of traffic, signals, lights, malls would be different, and then the behavior of a child who has never seen a village area, who has not been exposed to much of field areas and natural springs or natural environment. So there is no fixed scale for this behavior, only for the behavior assessment. Okay, sir. Nida Mohammed says, sir, can you speak on sensory behavior where the child 6-year-old tries to touch himself? What can be possible intervention? Yes. When I mentioned that with this ABC analysis, you'll be able to solve almost 50% of behavior problems. Why did I say almost 50%? Why not 100%? Because there are some behavior which are generated because of the sensory needs. So we need to do the sensory assessment for the child. Occupational therapists are the one who deal into that area, and they understand what are the sensory profiling of the child, and then what are the sensory needs of the child. Sometimes you find behaviors because of the sensory need that particular behavior is. So that's why I said that this behavior analysis will help you to solve half of the behavior issue, not all of them. So many behaviors are because of the sensory that we call them as sensory behavior. Right, so there are sensory needs of the child. Sometimes child would like to hold something, child would like to, like Oreo sensory needs, where child will put everything in the mouth, they will chew everything or they will not chew, or there are a lot of sensory things. Children will love to uh, children will have different behavior when they are exposed to more of lights or more of sunlight, or even in a mall or in a place where there are a lot of lighting. Children will have behaviors because of the sensory issues, that they are not able to adjust their senses, sensory input, and that an occupational therapist can do justice to that topic. Okay, Nida? Autism awareness needed in schools. Yes, we are trying from JKP Care Foundation. We are uh, conducting a lot of workshops and webinars in various schools for school teachers. We also have training programs for parents and professionals, like autism specialist training is a program, which is a 3 months long program. We have 12 sessions, 10 live sessions and 2 recorded sessions into it, where experts of each field comes and talks about autism and gives their input. We have sensory integration training program also, which is being led by Dr. Kanan Doshi, a renowned occupational therapist. And for school teachers also, we have a unique training program which educates them on various types of disabilities. That is IETT, that is that is the school teachers training program for the intellectual disabilities. So we teach them various types of conditions and how to handle those children. So we are trying our bit from our end, and you all can support us in the mission. Okay. He touches anywhere. Okay. Next is from Mansi. He touches anywhere to anybody in the school. Mansi's question is in continuation of no. I need to understand, Mansi. If you can unmute and tell me what exactly it is, I can help you better. Are you there,
Ac-
Mansi? Yeah.
Yeah, actually, he touches anywhere to anyone in school, any
See, when
parts
you,
of the body.
yeah. So when you say touches, then touching means it's sensitive. So he
Okay,
needs a detailed sensory profiling or sensory assessment, which can be done by an occupational therapist.
he is going for occupational therapist.
Hmm. So
He's
speak with your
going.
occupational therapist, and they can do a sensory profiling and understand what
Okay,
are the sensory needs of the child. Usually in such situations, we fulfill their sensory inputs. Like we can give them a handkerchief of various types of, you just try to give him handkerchief of different types of clothes, satin, cotton, synthetic, and see which they are holding it better, which they are enjoying better. So sometimes if you give this can help you in managing this situation. Then the child will get attached to that particular handkerchief and would not go and touch everyone.
okay,
Okay, try doing that strategy. Or
okay,
otherwise, we can discuss individually, and I can understand, because I will have to understand your child. So in detail, we can have a consultation where I can understand your child entire environment and concerns. I can bring in Dr.
okay,
Kanan Doshi also with me, who is almost 30 plus years experienced occupational therapist. She's
okay,
on the panel of GKP Care Foundation, and she can do the sensory profiling test, and we can further give you
okay,
guidance. We can do
okay.
that. Okay. Yeah.
Yeah.
All right. Next is, I'm going back to the question. Sorry. Sir, how can we stop a child throwing something? Why child is throwing something? That is a question here. Ola Vole Mary. You're there? No. Okay. So again, what child is getting, I would say consequence is child getting by throwing something? How old is the child? Is this a habit or a behavior? Now, again, another part is like one is behavior management. Okay, because behavior is coming because of antecedent or consequence. Second is behavior is coming from sensory needs. For that, we need to plan sensory diet. We call it sensory diet, where like I gave a handkerchief, so that is part of sensory diet. And third thing here is for in behavior is it a behavior or a habit? Lots of behavior become habit. And we try to correct them just thinking that it is a behavior. But sometimes it is a habit also. So am I getting a pleasure by throwing everything? Or is it it is the need of my body, the gross motors and fine motors that I like to hold, or I like to throw things? Or is it the attention which I get from you whenever I throw something out of the window, you suddenly give attention to me? So that we need to do analysis. Ola Vule, you are not there. Let me see in the participant list. I can see you because I need to understand this a little more and then I can answer it. Dr.
Yes,
Mansi,
sir.
yeah, you're there?
Yes,
Uh-huh.
I'm here.
Yes, yes. Tell me, how old is the child?
6 years. Grade,
6 years.
it's in grade one. Yes, grade one.
Okay. And where the child is throwing, what the child is throwing? That I want to understand.
Yes, when he's hungry, when he's getting hungry.
When he is getting
So,
hungry, he is throwing the thing
yes, yes.
because he has. And what do you do after he throws something?
When he's throwing something, I try to pet him to calm down and hold his hand, but still
Hmm.
not quiet.
Hmm.
He
So
will
now we know the,
continue. Then
yeah,
he want to gain my attention to play with him every time,
yes.
because he don't
So,
want to stay in the classroom. He
hmm,
always want to play outside. So whenever I said I will not play with him unless he listen to me, he will start throwing something, splitting, kicking, like that.
hmm, got it.
So I
So,
try
so now you
everything.
know. Uh-huh. Uh-huh.
Yes, I try all my possible best to make him calm down unless I play with him.
Got it. So now you know what is the antecedent in this situation. Antecedent is child wants to play with you or child is hungry. Child wants your attention. These are the three
Yes.
possible antecedents, right? After these three possible antecedents, behavior comes. Now you need to structure the routine, and in the routine, you need to give any of these three antecedents on a periodical timing. Like say after 20 minutes, you will do some two activity with the child for 1 minute, 2 minutes. Child will get the attention from you. Feeding, yes, you need to fix the timings. You need to make sure that child doesn't feel hungry. So then when the child doesn't feel hungry after 2 hours, after 2.5 hours, you are giving something to eat, but again with a balanced diet with the help of a dietitian, then the child will not get hungry and child will not have this behavior. Attention you are giving after every 20 minutes, 30 minutes, you are giving your attention to the child. So divide your day, structure in a way that you are able to give attention to your child. So child will not have the need. So alter with the attention, behavior will change.
Okay.
Alter with
Okay.
the antecedent, sorry, not attention, antecedent.
Okay.
You understand what
Thank
I
you.
meant? I'm trying to say. List down whenever child is showing you this behavior of throwing things. Just now you've just
Okay.
mentioned it, but most of the time we tend to forget also. Like suddenly we don't recall. when all child does this. So just this sheet which I have showed you in the same format, just list down whenever child has this throwing behavior, and what you give to child, that child gets settled. So that is consequence, right side, and in the left side, what are the possible reasons, antecedents. And then make a structure of the day, schedule of the day in a way that you are giving those antecedents well in advance so that behavior does not come. Whatever is the need, you are fulfilling the need well in advance. So then this behavior will automatically stop.
Okay.
Okay. Where are you
Okay.
from?
Nigeria.
Nigeria. Okay.
Yes.
Yes, you can
Thank
connect with
you.
me further. I'm typing my contact number in the chat box. Further, if you
Oh,
need any help, you can connect with me. I'll support you via WhatsApp. You can message me. I've mentioned my number.
oh,
So you can connect. All of
okay.
you, if anybody wants to connect, my number has been shared in the chat box. So you can
Oh,
take it down or save it and connect.
Sir,
okay. Okay. Thank you.
Yes.
sir, I just
Yes, ma'am.
want to add a question.
Hmm.
Uh, what what to do if it's a habit? Like, uh, if a
Accept,
um, child
accept
is
it.
having a
Accept it.
habit,
What to,
acceptance.
as long as the habit is not bothering you, then accept it. If habit is
Okay.
bothering, if habit is something which is
Hmm.
bothering you, then
Hmm.
try correcting the habit.
Okay.
I have a habit of drinking water in between of my talks. After every 5-10 minutes, I take a sip of water. That is a habit. Okay. Now, if it is bothering you all, or if it is bothering me, then I will correct it. But if it is not bothering me or bothering you, then I will continue with this habit. So far in this session also I've been
Actually,
doing that. I don't think you all had a problem with my habit or I had a problem with my habit. Then I'm continuing with this. Your husband might have, or your parents or your brother, sister, friends might have some habits which you accept as long as they don't bother you, right? And some habits which bother us, we try to correct them. No, this is wrong. You don't do this, right? We try to teach them or provide them support not to do that. So same applies to children. Yes, children with autism are different, but whatever mechanism we use on us or on others like us, same mechanism works with children with autism. How we try to correct?
actually,
Yes.
what is the reason behind asking me this question is, if my son is given the option, uh, whether to choose with this, these or this. So whichever the correct option is, he choose the next one to the correct option. So this has become the habit. So how to break this? I'm not
No.
getting it. Anything.
One thing is something which is correct for you, not necessarily that is correct for your child. You are saying this is the correct option. What if child is saying this is not the correct and that is the correct one? Next to correct is the correct one.
No, actually, I what I tried is uh, the letters with the ABC letters. So I am keeping all the letters like A, B, C, and
Hmm.
I give him the command show A. So he will show B, which is beside A, but he will not show A. If I
Okay.
said show B, so he will show C,
Hmm.
which is beside B. So how to correct this? This has to
You
be
just
corrected.
okay. Okay. You just show him A first, not A, B, C. Show him A and
Okay,
ask him to show you A.
okay,
Okay. Then put the B in the left side of it,
okay,
not in the right side. In routine, you put A, B, C, B in the right of A, correct?
hmm, correct,
Now
correct.
put the B in the left side of A and ask him to show you A.
Okay,
Okay.
okay,
Then put two A's and
okay,
one B. Two A's and one B. Then ask him to show the A.
okay,
Okay. And then you remove B, put C in place of B. Ask him to show the A. So practice with
okay,
A in 10 different ways. Then only you go with
okay,
A and B.
okay,
Okay. Then you take the child. First thing is that child should know A, B, C. What is A, what is B, what is C? Child should understand that. That is very, very important. In 10 different
Correct.
settings. What we do is usually, we know child knows A, child knows B. Individually, when I show to the child says correct. But when I show,
Correct.
join them, or when I put them side by side, and then I ask the child gets
Hmm.
confused and child shows different number, different alphabet.
Yes.
Okay. So
Yes.
in
Yes.
such situations, what we do is multiple of A's many times.
Okay.
And then let the child choose. This is A, this is also A, this is also A. Okay. Then
So
add
the
on
A
one.
should be in different fonts or in the same font.
No, same font. No problem. Don't confuse the child in different fonts right in beginning.
Okay.
Same fonts. Continue with the same fonts.
Okay.
Okay. Then once the child is confident of A in different settings, that A can be here, A can be in the right, A can be in the left, A can be on top, A can be on down. Then only you add on B. Do not be in hurry to
Okay.
add B there.
Okay.
Okay, and this goes with all of these things. I'm just missing the term what we call. Yes, this is part of generalization.
Okay.
Okay, when we show the child red color and we say this is red, I show a pen which is of red body, and I say this is red, this is red, this is red. And a pen which is of yellow body, I say this is yellow, this is yellow, this is yellow. For us, we are teaching the child colors. But what child is relating is that this pen name is red and this pen name is yellow. Then when I'm showing him a t-shirt of red color and I'm saying which color is this, child is not able to recall that color. Child says t-shirt. Because what he has understood is not red as color, he has understood red as a noun, as a pen. Name of the pen he has considered to be red. So similarly,
Actually,
generalize
what
in that
is
this, just a moment, I'll complete and then you say. So in this, what we need to do is generalization. Show him one article of red, 10 articles of red, same articles, like 10 pens of red color, same pens. We need to show and tell him this is red, this is red, this is red. And then show him two different things of red, three different things of red, 10 different things of red. This is how children with autism will connect. Okay, so this color is red. Otherwise,
hmm,
they might misunderstand the object with the color. Yes, Nilamri, go ahead.
uh, actually what is the problem now? He writes the spelling also. He writes spelling of different things. He writes in, on, under, between, in front of, behind. Everything he writes. But while recognizing the alphabet, why he does that, I am not able to get. And that is not the thing. If I place all the 26 letters in front of him, wherever the A is, he will look in that area only, and he will show exactly which is next to the A. So how this behavior has come and how to correct
It
it,
is
and
okay. Okay, if he's able to recognize and write the spellings correctly, then
huh,
Nilamri, it is something else to do. It's not just
okay,
the generalization. So you connect with me. We will discuss in detail about it, and then we'll find a
yes,
solution.
sir.
I need to understand more, and I also need to do a research on it. And it's but otherwise, his left and right concept, first and the last concept, next concept is all fine. Yeah. So
Yes, yes.
let us do. It's just with the A, B, C alphabets only. It's numbers. Numbers is also the same.
Numbers is also the same. Numbers, or if we keep all the things also na, in the row, whatever things like potato, tomato, and onion. So if we say that take onion, so he will take what is next to the onion. He will
So
take
this habit or this behavior is in the linear movement or in the horizontal movement also, like
uh
vertical
in
movement
every,
also.
yes, vertical and horizontal. Even in the cross movement is also there.
The same way he does.
Same way, same way.
This is a very unique case. This is a very unique case. Let me think a little bit and let me read more about it, and I'll get back to you. I
Yes,
need
sir.
to
Thank you.
understand it more. I will also do a little research on it, and I'll get back to you because I have not seen such situation with any child so far. Any expert here who understands this and can give input, most welcome to please give. Anybody who's expert on this or any parent also who has faced such situation? No? Okay, Nilamri, I'll get back to you on this for sure.
Yes, sir. Yes, sir. Thank you, sir. Thank you very much.
Dr. Mansi says, I understand that theoretically it seems easily doable. I have seen marriage failing down because of autistic children in the house. Marriage is not failing because of autistic children in the house, Mansi. Marriage is not failing because of autistic children. Marriage is failing because of not acceptance of autism, because of not education about autism. Marriage is failing because of that people are not aware about what autism is. People are considering it to be a mental disorder. People are not ready to accept it. Marriage is failing because they are scared about their future. Many times people say, okay, this child is with there is a defect in this girl, and we will marry the other girl, and we will have other child who's not having. So it is not failing because of the child. Please understand, it's failing because of the awareness and knowledge about autism and acceptance about. Yeah. But I agree with you that yes, parents of autism, be it fathers or mothers, they have to struggle a lot at every level. Financially, they are burdened. Therapies, cost of consultations and cost of these doctors is not less. Yes. So a financial burden gets added on. They were planning a smooth life. They were planning a baby. They were planning and building on their future. Suddenly, they need to alter their plans. Their income, they need to increase their income source, or they need to cut down on their expenses because they need to pay for therapies. Yes, I agree with that. Financial burden, social burden, social stigma and social burden, that you know stigma about the child with autism, about family members, relatives, torture from them, you know, families breaking. Yes, as you said, all this comes as a pressure. Then the third pressure is, what about the child? Whether child be able to lead proper life, whether he will be able to make a career, whether he'll be able to marry or not, what will happen to the child? What about what after us? What is going to happen to our child after us? So far, till the time I am there, I'll look after the child. But after me, who will look after? Who will take care of my child? So these are, yes, these are the burdens. And somehow uh, these burdens trouble parents a lot. But understand, you are special. You are competent. You are competent to handle these burdens. Even if marriage has failed, fine. Maybe God has selected you to raise the child alone. Be on your toes. Don't be afraid of anyone. Don't be afraid of this society. Don't be afraid of what people will say. If God has given you a responsibility, fulfill that. We are there to support you. With this concept, what after us, JKP Care Foundation has started a residential rehabilitation center for adults with autism. So currently we have 9 of them with us at our unit in Palghar, and we work with them, we play with them, we have made their schedule, and you'll be surprised that first child who joined us in he's an adult, but I still call them child because for me they all are my children. So February 2023 is the one when he is joined. So it's 1.5, almost 2 years, about 1.5 year plus. Child was with hyper sensitivity. Behavior was to, like, very hyperactive behavior, used to throw everything, was obsessed with cartoons, obsessed with stickers, had lots of tantrums. And today, the same child is the most obedient child. He is 29 years, most obedient child of Spandan. And today, he is learning computers. Any one of you is free to visit us in Mumbai, or if you want some videos or support, I will send it to you. You will be amazed to see that journey. You'll be amazed to see that journey. So it makes difference. The environment makes difference. What we have done with them is therapies, fine, but with therapies, we have worked a lot on it. Okay. So yes, you go through a lot of stress, but in this journey, you are not alone. JKP Healthcare team, entire team, all the professionals, all the team members are there with you. We all parents are there. Everyone, let us support each other and create a community of autism. So we all are here. We are also in the process. We are registering already the process has started. Soon you will get the news that one another organization is being registered for autism awareness, and we are going to take that awareness to the next level now with the new organization. I'll share with you all very soon. Okay. So yes, the marriages are failing. Dr. Mansi, you are saying that is right. Complete involvement with the child causes mental stress. You are correct. So that's why we said respite care and me time. How a single parent do respite care when no one is there to take care of the child? We are there to take care of the child. Connect with us, whichever city, whichever country you are in. I'll find you a support system, a genuine support system who will help you in respite care. I have, like, we have uh, trained more than 2,500. I think by now number would have gone really high. It was 2,500 on March 31st this year. Uh, Parents and professionals in various domains of autism. I will ask any one of them because I'm well connected with them, and I'm sure if I ask the help from any one of them, they will definitely come forward. Some of them are here. Neelamri, Chi Parveena, I mean, Dr. Captain Bhavna Gurnani. If I ask you, Parveena ma'am, if I come to you and ask you that I need some help for another child, will you not do it?
Yes, sir. Thank you.
So all the participants of different batches and programs and academies, whatever we have done, be it parents or therapists, I am confident that they all will come forward to support. So Dr. Mansi, if you have a parent, if you are a parent, I do not know, or if you have a parent who is struggling, do not feel that the parent is alone. We are there to support. Connect with me. I've given you my number anytime and we'll support. Okay. Stress in relationship affects them very badly. Agreed. Agreed. So that's why we need to provide them support. As professionals, we need to provide them support to handle their own stress. And stress in relationship does not affect only the parent, it affects the child's upbringing. It affects the child environment. So Dr. Payal also wants to know the answer for dealing with such situations. Let us do one thing. Let us keep another webinar, similar webinar on this topic, how to handle this parent stress, next Sunday at 4 o'clock. I'm fine with it. I'll speak with the team, JKP team, and get back to you all. Already contact numbers of everyone is there. I'm sending a registration link because some of them might have registered through reference that you have just got the link and you have joined. So I'm sending a link. Just go there and put your name, number, email address. That's it. No money or no transaction is involved. Just register here. So whenever we have the next session on parental stress and how to handle it, okay, we will have this session. Looking at the questions, I believe we should have this session. So we will send you the invite. You all will be notified that okay, we are doing this session. I'm putting it in the chat box. Simply go to this link, that is www.jkphealthcare.com/register. Once you go there, you will find a button to register. Just click on that button and you will, I mean, you can register. Whosoever has not registered for this webinar, whosoever has not given details, whosoever, like people who have already given the details, they don't need to do it again. Okay.
Thank you for your reply, and I will surely, refer your number to the concerned person. Other thing that I wanted to, I've mentioned in the chat also, I've seen that many psychiatrists they do prescribe antipsychotics to the autistic children. So I don't think, like, do you think that it's advisable? Because I think that's a malpractice. I've seen psychiatrists prescribing, Sizodon to a child of 3 to 4 years. Don't
See,
you
in
like? I believe that's the adult medication. Is it
yes, so
right?
I say that for autism we don't need any medication. be it resveratrol, Inspirol, Sizodon, all those medicines which are given. For autism, we don't need medication. Now, psychiatrists, they give medication for the comorbid conditions. So along with autism, if there are some comorbid conditions, there are some medicines to be given. So I don't question the, the qualifications or the expertise of a psychiatrist. I cannot do that on this platform and say or condemn that why he has given the medication, right? But Dr. Mansi, I am in favor that for autism, there is no medication. No medication is required for autism. Yes, sometimes when in rare situations, when extreme hyperactive situation is there to control them, or sleep disorders are there, to bring little bit of change for a smaller span of time, 1 month, 2 month, 3 months, we might need to take support of some medication.
Then
But by
so
the
why
same time, we
do
need to work
yeah,
on therapy.
yes, sir. Understood. Understood. Sorry to interrupt. Then why do the professionals in UK, they are not willing to prescribe such antipsychotics to children? They like when such children are referred to the professionals in UK, like psychiatrists also, they don't
Mhm.
prescribe such medications, and even they are like against this. So
Yeah.
how to deal with that then? Because my
So
sister-in-law, she is facing this issue, and now she's in London.
mhm.
The professionals in London has advised her to stop the medications at once. And the child, she has been taking these medications from like 2 to 3 years now.
Mhm.
She's on it. Now suddenly, like stopping the medications altogether might, affect her badly.
Yes,
So
yes, it
then how
does,
to
and
deal with that then?
it needs to be handled very, very carefully. See, question is first. There are a couple of questions in this question. One question is why in UK they are not prescribing medicine, and why in India they are prescribing medicine. Let me tell you, in the UK or US, if you go, they don't prescribe antibiotics also. And in India, anything you have, even if you have common cold and flu, first thing you take is antibiotic. So there is the difference in medication system in India and in the Western world, and that's why their practice is different. Okay. Yes, I stand with my point that for autism, be it UK, be it India, be it the states, anywhere in the world, there is no medicine and no medicine should be prescribed. Now, the second part which you are coming on, that how to deal with this situation. So my recommendation here would be that do not stop it immediately. Whatever medicines leftover stock she has, ask her to slowly reduce the dose but continue till the time she has those doses. So when you want to stop medication, you need to add on the therapies to support, plus same time be prepared to handle behavioral changes and also reduce the dose slowly and then come to zero. Don't come to zero in one day.
Yeah, I agree. I agree. And I'm very much like happy about your foundation, sir, because India needs such foundations. So thank you so much for this step.
Thank you, Dr. Mansi. You are from?
I'm from Goa, sir.
Oh, you're from Goa. Okay. We have
Yeah.
clinics in Goa, in Vasco and Margao. I have
Nice.
practiced in Goa for long. I have been in
Nice.
Goa. I have practiced in Goa. I'm well connected
I
in
would like to meet you
Goa.
one day, sir. I'll
Yeah,
definitely
sure.
want to
You are
meet.
from which
I
background?
am
You
a
are
dentist, and I am a dentist as well as a counseling psychologist. I recently completed my psychology.
okay. Okay. And
Yeah.
which part of Goa?
Sir, North Goa, Panjim.
Panjim. Okay.
Yeah.
Yes. All right.
Thank you, sir.
Surely I'll
Thank you,
connect
sir.
with you. Whenever I'm visiting next, I'll connect with you for sure. Okay.
Thank you.
Okay. The next question we will take. Anybody wants to ask question, you can ask in between. No problems. I'm just answering one by one. But in between, if anybody has questions, you can ask.
Please, can we get the recordings, please, after the class? After
I'm
this,
sorry.
please, can we get the recordings, like the
Yes,
recorded
yes, yes.
session?
I will share. I will create a recording link and I'll share with you all. You have already given your contact details. You've registered, right?
No, I just saw the link and then I joined, so I'm going to register properly.
So I have messaged just now, right? I've messaged in the
Okay.
chat box the
Yeah,
link.
I'm going to,
So,
yes,
yeah,
I'm
yeah.
going
So
to
just
register.
yes, yes. So just register there. I will send you recording. I will send my team. I'll ask my team to send the recording to all of you.
All right. Thank you.
Okay.
Thanks for the class.
Sure, sure, sure. Okay. Any other question? Okay. Next question we will go. I think I need to scroll them. Okay, Mary Das. Mary says, what is the EDOS assessment in psychology and how it is important to check the mental age of the child? EDOS is one type of assessment which we use for autism diagnosis. It is called Autism Diagnosis Observation Schedule, the full form of EDOS is. And it is one of the assessment which we do for autism. And how important it is to check the mental age of the child. Yes, it is very, very important. Very, very important. So we have two types of age and two types of age in every stage, every domain, not only the psychology. In speech also we have two types of age. In behavior also we have two types of age. In diet also we have two types of age, which is one is chronological age, another is mental age. Chronological age is with the calendar. Somebody who's born in 2000, today in 2024, he is expected to be 24 years. We say 24 years. So the calculative age, which you can calculate in numbers, is this. But then developmental age, which is in psychology, we say mental age, is the age uh, looking at the overall development of the child, the development of the brain. So a child who is 4 years old might be on basis of developmental domains, might be of 2 years of mental age. Why it is important? Why it is important to know that? It is important to know that so that we can provide, we can create appropriate curriculum for the child. Appropriate curriculum in the therapies, appropriate curriculum for the basic learnings for the child. Because otherwise, I will look at the child 4 years, looking at the height, body, or the calendar age, and I will create structure. I'll create the whole IEP, which I say education plan or therapy plan, ITPs, on the basis of 4 years. If I do not know, and the child is mentally, child's age is meant the development is of 2 years age, then child will not be able to cope up with that age, that plan which I have made, and my therapies will go waste. Otherwise, child will go under stress. So it is like you are teaching, you are putting a child who is of 10 years into an MBA curriculum, right? So how much burden child will take? So
Sir,
all
it
the therapy
is
plans, all the education plans which we make should be age appropriate. When we say age appropriate, in terms in the psychology field or in terms of mental disorders or in terms of the autism, then it is mental age. Whenever I'm referring age, I'm referring mental age, not the age of chronological age. Yes, Mary.
so is it necessary to do for every kid with who's on a spectrum or who has
See,
autism?
kids who are on spectrum, usually we do the developmental age check. We don't have to do it separately. We check them on various domains, and in the domains wherever is the deficit. So we work on the deficit areas, right? So a good curriculum would be which is targeted to deficits with the help of strengths. So it is not necessary to know for all the children separately. When you are doing the deficit assessment, automatically your developmental assessment is being done. Yeah.
Okay.
So it comes
Okay.
with the expertise. It comes, the more children you see, the more children you practice with, it comes with the expertise and you can say, okay, child stands here. So you don't have to put the pressure on the child for another assessment or pressure, financial burden on the parents for another assessment. Okay,
Okay.
I don't even recommend, I don't recommend much of the assessments and like the formal assessments to be done until unless it is necessary, because parents are already overburdened. Parents are already, because for every assessment they need to go to a clinical psychologist. So they need to spend lots of money, and it is, these all assessments are very costly. Even IQ testing, I don't never recommend IQ testing in autism. There is no correlation between IQ and autism, I believe. So there are many professionals I've seen that there's a write down. Okay, you need to do IQ testing, this, that. But IQ testing has no scientific evidence that there's no scientific evidence that IQ and autism have any relation. A child with exceptional IQ can also have autism. So IQ testing also I don't recommend. Okay. Yes.
Okay.
Going next question. Inclusion is part of our practice, but how do we educate, explain to other parents who are seeing the child with ASD in the class and starts talking about this child and sometimes ask the teacher to keep an eye on her child because this child with ASD might hurt the child. Very, 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 I would say related question because this I face every day. This I face every day. Parents who have neurotypical children or children who have regular development, parents of those children are always worried about inclusive society. And whenever there is a child with autism, they ask the teacher to keep an eye. They ask the teacher they ask the child not to sit with that child. Otherwise, you will become like that. Yes, this is likely to happen. Children learn from each other. So a part of imitation is likely to happen. So when we go make towards the inclusive education, then and IEP 2020 also says inclusive education. So in inclusive education, what happens is when a child with ASD is part of a classroom, other children tend to pick up few things from him and imitate. And once they do that at home, parents they immediately get triggered and they come to the school management, they fight with them, they complain, they say, no, this child should not be in this class, this child should go to special school, why this child is here, and our child will become like him, and we need to educate them. So how we can do this can be done by educating the teachers and by addressing this challenge in PTMs. So when we create awareness among teachers with the school management, and then the teachers can create awareness to parents. So we can have parents training sessions on autism, creating awareness. We can do that with the help of teachers. We can do. But yes, it is needed to be done. It is really needed to be done. Okay. Some of the schools I see that they have created resource room. Whenever a child has some hyperactivity or some behavior, they take the child out and send him to the resource room. Every time. And this becomes a routine. Child is in the regular schooling and child goes to the classroom, 1 or 2 classes they attended. Then child has behavior, child is put in the resource room. And we call it inclusive education system. But is it inclusive education? Child is being sent to the resource room. Behavior is not being handled in the class. Teachers are not trained to handle the behavior. Rather, child is being thrown out of the class, sent to resource room. For you, it can be a reward. Okay, child is going to the resource room. We are not giving him punishment. He's going to the resource room. But for the child, it could be a punishment that every time he's being sent to the resource room. Look at the psychology of other 30 children in the classroom. How will they develop? Once they grown up as an adult, they will see that these children should be thrown out. These children should be kept in the resource room. So when what they see in the childhood, once they grow up, they will see that only, okay, these children should be thrown away. These are not to be part of us. They should be kept away. So that is not inclusion. I call that as exclusion. Inclusion is when every class, every teacher is being trained on handling various aspects of autism. And then the autism child is there. So parents come to me asking for the advice, should I put my child in the regular schooling or should I put my child to the special schools? My answer to them is neither of them. Why neither of them? Let me tell you. If I put my child who has autism in the regular schooling, what happens there is exclusion, not inclusion. Exclusion. They anytime, because if the teachers are not trained, if management is not cooperative, they every time put the child in the resource room or take the child out of the classroom. What my child is going to learn there? And what how other children are behaving with him? What is the environment he's getting? Then if I take my child to the special school is the school which is for MR children. mentally retardation conditions. In such school, my autism is not MR. Autism is not mental retardation. Autism is just differentiation. So in such school, my child will not get correct child environment because their plans, their therapies, their goals are mental retardation. So we need to have inclusion in regular schools with autism trained professionals. That's why we are working here. So we need to train, we need to find a school, maybe a small school, no need to run behind big brands and big schools. I am not against them, but if bigger schools are not having supportive environment for our children, no need to go there. Our child can do very well in a small school nearby to our house where child is getting proper environment. We are getting opportunity to go there often and train the teachers or give them the support whichever is my child requires. Okay. Yes. Next we'll go Pooja. Yeah, Pooja Gaonkar. What is the best response as parent therapist towards a child who is hitting, biting, crying, starts crying, ignore the behavior or give more love? Neither ignore nor pamper. Try to understand, do the ABC analysis and try to reduce the behavior frequencies, the degree of behavior by antecedent behavior and consequence analysis, number one. Number two, during the behavior, what should I do? During the behavior, divert the attention. During the behavior, do not give them any commands. Give them a hug, yes, provide them love, fine. But love should not be mistaken that I'm allowed to do this and number of times I want to do it. Okay. So give them the divert their attention. Do not ignore. Sometimes we say ignore, but yes, if the degree of behavior is very less, then you ignore. But at times, if you ignore, then behavior degree becomes small. So ignorance will also create an issue in long run that child will understand, oh, by doing this, nothing is happening, then let me do a little more. So hyperactivity increases with ignorance. So do not ignore. A little angle of love, that is like support to the child, but divert child's attention. Change in the environment, child environment. I say that for the parents, I say in your house, make a small corner, which is your child's corner, as per age appropriate corner of the child. And you can do it within the room itself. No need to have a separate room or something. Say 20-30 square feet area of the room, put a ribbon there or put a kind of you have easily available on Amazon and all the plastic partitions, white color, that fencing type of thing. So you put that there and put mattresses down. So floor should be covered. No hazard should be there, that no furniture in that corner. Nothing, no nails on the wall, no wall paintings or no electric switches should be there in that corner. Just the mattress on the floor, mattress on the walls also. Mattress as in a cushion, foam or something soft boards on the all three sides of wall, at least till the height of the child. 3 feet. If the child is 3 feet, 3 feet. If the child is 3.5 or 2.5, 2.5, till the height of child, just put a cushion there on the wall also. Okay. Put some toys, soft toys in there. Whenever child has hyperactivity, for any reason, whenever child has hyperactivity, take the child and put the child in child spot. Otherwise, don't make this a child play area. It is not a child play area. It is an area where you have protected walls, that is protected from all three sides on the walls. No nails, no corners of furniture or nothing else, just a partition to divide that area with the other room, and some soft toys there and mattress on floor. But it is not a play area. It is the area of managing behavior. So take the child, whenever child has hyperactivity, first thing is you take the child, put the child there in that area, sit with him, and then you will see that attention has been diverted immediately. Then you work on the real cause of hyperactivity. What is the real cause? Probably child is hungry, you feed the child. Probably child wants to play with a particular toy, you play. Probably child wants your attention, you give the attention. But the moment you bring the child in this area in hyperactivity, you will see hyperactivity is gone. And slowly you will realize that the moment child starts symptoms of hyperactivity, you bring the child in this area, that hyperactivity's degree slowly goes down. In a month's time, slowly, when I say it doesn't happen overnight, but in a month's time, you will say child's behavior have been settled. Okay, so antecedent and consequence you need to work with, but at the same time, diversion of attention can be helped with this child play area. That shall help you. Steffi Clara, my son is 3-year-old now, is having some sensory issues. I don't know whether he is in ADHD or autism. Steffi, 3 years is a good age. Do not delay. Connect with any of the clinical psychologists there who's ready to do the assessment, or if required, we are there to support you online. I do not know your location if you are here, because many of the participants have left already. It's getting too long. I can't see your name. I'm sorry. Yeah, you are there. Steffi, you are there. Where are you from? The location. You can unmute.
Yes, sir. I'm from Coimbatore, sir, Tamil Nadu.
Okay. So, Steffi, Coimbatore, right? Just
Yes,
message
sir.
me. I can connect you with some professionals from Coimbatore. You can connect with them. Do not delay. If you are finding any developmental delays in your child, any red flags in your child. So I'll send you first. I'll send you the red flag chart. Go through that. Do the assessment of your child on your own. Check the child on all the domains, whether child domains are working properly. If you find something is missing, maybe in speech area or maybe in other areas, then immediately connect with a professional. 3 years is a good age. Do not delay. Okay.
Okay. Actually, it's late in speech. So we are already went to the OT and occupational therapy and speech therapy. So it's going on.
Oh, then what is the question here that you are saying you do not know
So,
whether child is with ADHD or autism?
so I think ADHD means it's attention deficit, and I think there's a difference between ADHD and autism.
Yes, yes. ADHD and autism are different. Attention deficit hyperactivity disorder is called ADHD, and autism, that is autism. But when there are children who have autism and ADHD both also. They are comorbid conditions at times. So at times, the child will have only autism. At times, child with autism can have ADHD as well. For that, we need to do a detailed assessment. Steffi, you can connect with me. I can do that online also.
Okay, okay, sir, sure.
Yeah, I have mentioned my number. Just message me. I can do the online assessment and I can let you know about if the child is with ADHD or not. Okay. I misunderstood that you do not know whether child has autism or any disorders and you want to check that. I misunderstood your question. Thanks. Pravina ji, therapy centers collect too much money and hiding what therapy they are giving. Pravina ji, in this world, all 5 fingers are not the same, and there are every type of people. So in general, I will neither support this statement, I'll nor condemn this statement. Okay, so every type of people are there. So yes, you need to look for the people who can support. Money is the need of everyone. So people do collect money because they need to run their own families and life. As a teacher, you are teaching in the school, you are getting paid. So therapy centers, when they're giving therapy, they need money. But yes, same time, it should be justifiable. It should not be overpriced. It should be considered for considerable amount for the parent. And same time, what therapy they are giving is like they hide. Oh,
Yes, sir.
that is what I can condemn. Without including parent in the vertical of autism management, we cannot get desired successful results. Parents are important part. That is a message to all the therapists also who are here. Parents are very, very important part. Child can come to you for therapy for 2 hours, 3 hours, 5 hours, 6 hours a day. But the day you involve parent in your therapies, let them work as a co-therapist with you, teach them whatever skills you have. Do not be scared that parent will run away. More number of children you bring improvement, you will get more referrals. And that is what I believe that this strategy has worked with me in a very beautiful way. I have always seen to it that I release the child as soon as possible. I bring the development as soon as possible. For that, if I have to include neighbors, if I have to include family relatives, family members, grandparents, parents, I do everything. So not the whole burden of development is not only on the therapist. I bring everyone together. I have been to schools. I've spoken to the teacher and management also. I've given some training to them also just because of one child. But then I have seen wonderful development in that child. And because of that one child development, I have got patients. Still, I get patients referrals from around the world. So therapists should not hide what they are giving, why they are giving, what and why. Never hide. Share your knowledge. Share your knowledge with other therapists also. Don't have a threat. This industry is very small and it is to collaborate. It is not to compete. We are not, product manufacturing industry where somebody will copy us. Whatever knowledge and expertise you have, nobody can copy that. Share it as much as possible. The more you share, more you will learn. Now, today's this webinar, I'm learning a lot from you all. Nilamri has given already a new case to me, which I need to look into and I need to learn more. Okay. Yes, Pravina ji. Next.
Thank you,
Anand.
sir.
My son is 6-year-old now in first grade. Complaint from school is grabbing pencils, books from other students. How can I explain my son not to do these things? It's a very common behavior.
Sir,
Children do
excuse me.
this.
He is
Yeah.
my son, sir. Anant is my son, sir. We are both in the same webinar.
Okay, Anant is also here. Okay. Welcome, welcome, Anant.
Sir, hi, sir. Hi.
Hi, Anant. I must say that you are a blessed parent
Yes, sir.
because in my entire trainings, Pravina ji is the only grandmother who is coming forward and taking a training for grandchild.
Yes,
So
sir. Yes.
you are really blessed that you have child with autism, but you have mother who's there to support with you, who's
Yes,
taking
sir.
out so
Yes.
much. Yeah.
Yes.
So yes, this is a very common thing. Sometimes, these are very small childhood things that we take pens and pencils from other children. We should not be much worried about it as long as it becomes on a very higher degree that he's just snatching it from everyone. Sometimes if he's taking from others, is fine. Okay. But if he's snatching it from everyone, then probably we need to teach him few concepts. Few concepts is turn taking, patience, and not this is mine and this is not mine. That is personal belonging of me. I can use it, but I cannot use others' items. So these are the
Yes,
concepts
sir.
which need to be taught.
Sir, actually, this was a complaint from previous school also. Actually, he's now first grade. I have changed two schools in first grade. So this is a major complaint coming from previous school. Now I changed other school. This is a ongoing complaint from the teachers also.
So,
So
so changing school will not help in this situation, right?
the management is not at all accepting, like they are saying, we don't accept these type of kids because see, at first grade every child in that school is speaking, they can communicate with their parents. They are complaining about my kid to their parents, so this was a complaint from parents too. So that was a major problem for me to change the previous school. Now I joined in other school. From this school also, that is a major complaint. He's grabbing pens, books, pencils, everything, and throwing outside the window, and not at all, no sitting position. This is only because we are giving continuation therapy. My kid has changed a lot. Like it has changed a lot. Okay, that is fine. But this thing is not going. We cannot overcome this situation. This type of situation. And one more thing, we stopped the therapy. We stopped the therapy because just now my mother asked a question. Right, they are not at all hiding. They're not at all. Explaining what the situation is going on in therapies, and they're charging more and more money, but my kid has changed. My kid has changed little bit, and he the reason for stopping therapy is he's getting lot of fear. He's not at all going to therapy. We are asking, are you like beating up my kid or doing because he is not at all showing interest to come therapy. So we are asking, See, this is things happening in therapies. Two to three therapists. This is the same situation. So we stop the therapy because at this 6 years of age, why to bother him? Why to? So we are only teaching him some little aspects. So, but these situations, we cannot overcome these situations. These complaints from school. That's it.
So Anant, I think here we are going a little wrong. We need to work in detail on this situation because stopping therapy, I will never recommend. Is he's not just 6 years, he's 6 years. Okay.
Yes.
Early intervention is very, very important in autism. More the child grows, it becomes more difficult to make changes because neural communication is increasing with the age. And there are two types of development in children. That is, one is as we have two types of age, similarly, we have two types of development: chronological development, which is due to happen with the age. So, which you are seeing, okay, even without therapy, he is developing. But at the same time, there is therapeutical development, which is supposed to happen. Now, therapist is not sharing or he is not going to the therapy center. He is not willing to go. We need to understand what is going on at the therapy center, what kind of therapy he is taking, what activities they are doing. We need to make it more interesting and motivating for him. So connect with me on individual basis, Anant. So you take my number from your mother, and
Sure.
I will understand from you first, and we will work on it. I'll guide you what all we can do. We'll speak with the therapist also if it is required. But
Yes, sir.
stopping the therapy will not. I'll not recommend because you know 6, 7. Even if there are certain domains where if I feel after talking to you, if I feel that there are certain domains where I can support you or my team can support you, we will support you. Okay, online, and we'll guide you and we will ask you to become a co-therapist. But stopping therapy is not. Okay.
Okay, sir. Okay.
So let us
Thank
discuss in detail about it and one to
you.
one, and we will find a solution.
Sure,
Because
sir.
the way you are mentioning it, I am finding it a little bit of ADHD also, like attention deficit hyperactivity, because as you are saying, he's not sitting in the class and he's throwing away things, but need to understand more in detail. Okay, before
Yes.
coming to the solution.
Okay, sir. Okay.
All right, next, Tahura. Tahura, sir, as you said, it is a difference, not a disorder. Then why it is called autism spectrum disorder? Yes, I gave a disclaimer also right in the beginning that it is called autism spectrum disorder, but as per my experience, I say it is a difference. It is not. I mentioned as per my experience, my opinion. Okay, I'm not saying it is. It should be accepted by world, but my opinion and my experience says it is a difference. And you will find not only me, you will find thousands of professionals who will say the same, that it is a difference. So it should not be called autism spectrum disorder. It should be called something else, but not disorder. Okay. Yes. Next is Dr. Payal. Sir, how to deal with behavioral issues with fixation? Generalization is the answer of fixation. So we need to do generalization activities. Fixation slowly goes up. Takes time, but yes, Dr. Payal, we need to do the generalization. Archana Gautam, to rate autism, we use cars to know the degree of this. We don't have to get into, Archana, I believe, in the degree of autism or child is with mild, moderate, severe autism, or there is no parameter to have the percentage of autism. Okay, like in MR conditions, we say 50%, 60%. On UDID card, I see people write mental retardation. Unfortunately, in India, autism is still classified under MR. That is very, very unfortunate. Our association has written to Government of India many a times, but no action has been taken to take autism differently. But irrespective of all that, what I believe in autism, we should work individually, case to case basis, considering deficits and the strengths of the child, without putting them into the levels of moderate or percentage. Okay. Then my 6 year child, inappropriate laughing, jumping, lack of attention, behavior showing, playing with water. These all are very common traits of autism, Pravina ji. You need not to worry about it. Inappropriate laughing, jumping, lack of attention, playing with water could be sensory also, or there are some children who love to play with water. So it's very common in autism. Need not to worry much. With slowly, when we work on autism, slowly it will go up. Rhoda, is it good for an autism child to be in normal children school? If yes, will not affect normal children. Yes, we have just discussed this, that some children might start imitating initially, but with the correct environment, correct learnings, this will not affect children, normal children. I'm sure this will not affect normal children. Initially, you will see some children might start imitating. Some children have, because children learn from each other. So if child with autism is doing something, others will also do so. Might do, okay. But at the same time, other children are doing something. Autism child will also learn a lot from them. So, but in long run, it is not going to harm because other children will eventually understand. Their brain is developing and they will eventually understand this is not acceptable. We are not supposed to do this. So this will not harm them in long run. Okay. But yes, school management and teachers should be trained on it. That is very much necessary. Ola Bole Mary, my child is okay 80%, but sometimes he's throwing something, kicked, splitting, and he doesn't sitting down in the classroom. Yes, we have discussed this. We will connect with me on one-to-one Ola Bole and we will get into this more details. Sarita Sakuja, sir, maximum child jumping all the time. How can we handle it to manage? Child is jumping all the time means child is producing extra energy and which he is trying to spend by jumping all the time. So a detailed diet assessment will also help you. And the same time, physical activity. So you would give them by jumping what he is doing. Child is doing physical activity by jumping, trying to burn the energy which is excess in the body. You cannot jump all the time. You will jump for 10 minutes, 5 minutes, and you will get tired. Child is not getting tired. It means child is producing excess energy. Now, with correct diet and nutrition, do not stop diet, do not reduce food. Okay, correct diet and nutrition. Sometimes we reduce the sugar content for it, but that should also be done after a consultation from dietitian who is trained on autism. We have in JKP, we have Dr. Sushila Sarandar, who is 40 plus years experienced in the field, and she is dedicated for autism and other disorders. So you may connect with us, or you may find anyone in your area, a dietitian who's trained, who's well versed with autism, and try to find a registered dietitian, because field of dietetics is also very unorganized. There are some courses, some people just by doing 2-3 months course, diploma program or a certificate course, after 12th people are calling themselves dietitian, which is not right. So registered dietitian, somebody who has done graduation, post graduation into diet and nutritionist with a good experience and exposure with autism, is the right person who can support you with this. So diet plans and as well as activities. You need to add, Sarita, you need to add structured physical activities for the child. So 1 hour of structured physical activity, next 3 hours, child will not do much of jumping, right? Next, Dhananjay, my 7.5-year Down syndrome son has always fold and unfold towel and handkerchief, and where we take, he becomes angry, irritated, and sometimes crying. Dhananjay, since the child is with Down syndrome, I am not an expert to that, so I'll not be able to answer this question. I can surely put you to an expert who can help you out. So just message me. I'll give you the contact details, contact numbers of the expert who can work on the Down syndrome, because I have specialized myself into autism, and Down syndrome is not, I'm not much aware about it. So I'll not just like to give you any answer. I'm really sorry about it. Okay. All right. Thank you, note. Thank you, note from Ashwini. Fine. Thank you, sir. Good, wonderful session. Informative. Have to put in practice ABC. Yes, please, please, Asma, practice ABC. That will help a lot for sure. Okay, Dr. Mansi, we have already discussed this. Next is Pravina. Thank you. Marin Egonoy. Inclusion is part of our practice, but how do we educate, explain to other parents? First thing, we have already answered this question. Please suggest therapist in Chennai. Yeah, Kartika, please message me. I will WhatsApp me. I'll understand from you which therapist you want and what is the concerns. And accordingly, I'll suggest. I'm connected with many of them in Chennai. I'll surely. Okay, thank you, note from Olavule. Thank you. I'll surely share details. Okay. Thank you, Mansi, Dr. Mansi. So far. would it be possible for you to kindly provide information how we may join our upcoming webinar? Yes, I have mentioned the link just below your message. Saukenakit. I'm sorry, I'm not able to pronounce your name properly if I'm wrong. So www.jkphealthcare.com/register. Just go there, put your name and details, contact number and email address. Whenever we have a next webinar, you will get an intimation from us. I'm trying to keep it next Sunday itself. Parental on how to manage parental stress. So anybody who's willing to join, you can join. You will get the information. Recordings, yes, recordings. I'll speak with the team and they will share the recording of today's session link. They'll create a link and share it with all of you. Archana Gautam says, if child need medicine, we can give. Yes, we need to give them medicines for conditions, comorbid conditions or physical concerns. We need to give them medicines. But for autism specifically, okay, autism is there and give this medicine and autism will go away. Ayurvedic medicine, homeopathic medicine, there is no research because I will go with the evidence. There is no research or evidence, scientific evidence that says that this is the medicine for autism. That is what I mean to convey. Yes, Archana ji. Dr. Payal, we need to taper down the doses of medication. Yes, we need to taper down slowly, not even one single day. Sir, how to deal with behavioral issues with fixation? That we have answered. Generalization. Fear to attend therapy. Yes, Pravina ji, I have already told to your son to connect with me. I will try to understand what is going on in therapy. If possible, I'll speak with the therapist also and answer. Marilyn, thank you, Dhananjay. Can you share red flag charts along with us? Yes, sure, Ayushi. I'll share the red flag chart with all of you. Along with the recording, I'll ask the team to share the red flag chart also with all of you. Sure. And it is easily available on Google. You can search on Google as well, but I'll share. All right. Thank you. Thank you, everyone. Any other question? If not, then we can wind up today's session.
Thank you, sir.
All right. Thank you. There is one question which has come in, which has just come up. Is it possible to change the behavior if she is 12 years? It is possible to amend the behavior even if she is 60 years. Don't worry.
Okay.
We can work. We can work on the behavior at any age. But yes, with the development of mind, well, development of brain, in early years it becomes easy. Later, it becomes a little difficult. That's the only thing. It is not impossible. As I mentioned just before some time about Spandan, a kid of 29 years, we have changed a lot of concerns within 1.5 years. There is a tremendous change. The entire personality is changed. So it is possible, very much possible. Thank you all. Thank you very much. I will share the Google review link also and request you all to kindly rate and review us. It will help us to create more awareness and it will motivate us as well. So kindly do that. And I am once again putting in my contact number. Anyone who needs support, you can connect with me. Any kind of support related to autism. If anybody in your known circle is in need of support, please do refer. Thank you so much. Wish you all a wonderful Diwali. Enjoy the celebration, and we'll meet up soon.
The same, sir. Thank you very much.
Thank
Namaste.
you.
Thank you. Thank you.
Thank you.